Okay, hello and welcome to Body Talk. This is part one of a three-part series. We're going to be talking about just some body image basics today. And we're just really glad that you're viewing this or here today. And I'm going to take a quick second to introduce myself. My name is Emily Kerr. I'm a registered dietitian. My pronouns are she, her, and I work at the Student Health Center. And I've been a dietitian at the time of this recording for about 14 years and have been working at the Student Health Center for a little over 4 years. And I'm gonna let my co-host introduce herself.
Hi, everybody. Thank y'all for being here, and thank you, Emily. My name's Crystal Loop. I'm a wellness coordinator in the Student Health Center, and I work with Emily. I have the great pleasure of doing so. I've been at the health center for a little over a year and a half, or about a year and a half, and I also have experience counseling in the community. Next slide, please. So just a little bit about the Student Health Center, especially if you're unfamiliar. We are located on Infirmary Road, past the School of Music, near the Enchanted Forest. At the Student Health Center, we have three main service areas, including our medical clinic, mental health service, and wellness and health promotion. We are currently offering both in-person and telehealth services, but we encourage you to check our website listed on the slide for updated information about our services. Next slide. We do want to give a trigger warning before we really get into the meat of this presentation. We are talking about body image, which for many of us can be a very distressing topic. We will be talking about weight, body shape and size, as well as eating disorders in this presentation. We also want to bring to light our own lived-in experiences to the discussion today, because these experiences impact how we are presenting the information to you, as well as how we think about our own body image. Emily and I each have our own unique experiences of living in our respective bodies, so I'll speak to mine first and then let Emily speak to hers. So I, Crystal, I'm a Middle Eastern cisgender female, and I live in what I consider a larger body. In my own life, I've experienced times of discomfort or distress in my body, and I've experienced times of greater self-acceptance.
So I, Emily, am a white cisgender female. I live in what I would consider a smaller body. And I also sometimes experience discomfort in my own body image, and also I experience times of increased acceptance and continue to work towards ongoing acceptance.
Great point, me too. Working towards ongoing acceptance, which is part of the reason why Emily and I decided we really wanted to do this. So as we talked about our own personal lived-in experiences, we also want to talk about our personal privileges that each of us may have for different reasons. So I can speak to mine. While I do live in a larger body, I still experience certain privileges with regards to my size, my shape, my mobility. And I do identify as a person of color, but I also experience light skin privilege and have had the experience of passing as white oftentimes, or even a different cultural background that may not have as much baggage associated with it as my own. This type of privilege that I'm bringing up, this exists in all of us, and particularly as clinicians. If we leave this unchecked, this can contribute to biases or assumptions when we are working with students or other clients. So we're aware that whether it is medical professionals, mental health professionals, nutrition professionals, or any other health care clinicians, gender bias, racial bias, weight bias, and other biases can get in the way of us providing accurate and helpful treatment. So we really hope to expose some of these biases and privileges as we work through these three parts. And we invite you to contribute your thoughts on this. We will give our contact information at the end of this presentation, so please feel free to submit any feedback or thoughts at the end. Next slide, please.
That is so well put, Crystal. Thank you so much. So I am just going to give a quick rundown of some of the things that we're going to cover in today's presentation. So our objectives, as I mentioned, this is part one of a three-part series, and we're going to discuss just really a little bit about what body image is, the relevance that it has for us, and trying to tease apart the difference between body dissatisfaction versus disorder. Touching on a little bit about how body image develops, some common dilemmas that we might face, the impact that COVID-19 could have for body image or for someone that's struggling with body image, as well as some tools for self-assessments and additional resources.
So we'll kick this off with just defining what body image is. So I'm going to read this out. Body image is defined as one's thoughts, perceptions, and attitudes about their physical experience. So have you ever maybe complained about your physical appearance and had a friend or family member respond by saying something like, "Oh no, but you're so blank, thin, or you're so beautiful, or you're so strong"? This response from our loved ones is usually well-meaning. It implies that the way that you're feeling about yourself is not the way that they see you. So that's really the thing about body image, is that it is this subjective experience, meaning that it doesn't really matter so much how you appear on the outside to others. Body image is all about your own thoughts, feelings, and attitudes about how you see yourself. Body image refers to how you personally experience living in your body. And I really like this word embodiment to define what body image can be and living in that body. So one way to start figuring out how you may personally experience living in your body is to consider this. How do you see yourself and feel about your body when you look in the mirror, maybe when you're all alone? How you respond to this question may tell you a little bit about what it is to be living in your body. Body image is complex and it's multifaceted. So your body image is influenced by an infinite amount of factors over the course of your lifetime. It's also ever changing and may seem like it fluctuates from one day or even one moment to the next. Our goal in this program is to help you identify some of the factors that influence body image and help you stabilize a more healthy or balanced body image overall. Next slide, please.
So I also we wanted to address some expectations and acknowledge that body image work is really a very long distance race. It's not a sprint. For someone that is working on improvements with body image, changing our thoughts related to our body image can take up to 18 to 24 months or even longer. So I know for myself and working with clients with eating disorders or body image challenges, we kind of have this idea of wanting to have this really fast and rapid change to our thoughts, but it's definitely something that takes a significant amount of time and effort. And we couldn't do this, talk about this topic without acknowledging that we're not going to love our body 100% of the time, and that's totally okay. And really just being able to also acknowledge that we can separate our goals of weight loss from being able to accept our body. Even if we are striving for a change in our body, it doesn't necessarily mean that we don't have acceptance. So we're going to dive in a little bit more later and kind of what the differences are between that. And this is just a wonderful, beautiful quote from Marcy Evans, who's a registered dietitian that works in eating disorders and body image work. And I'm just going to read that for us. To me, body image work is not about trying to feel positive about how you look. It's about developing a different kind of relationship to what it has been like and what it is like for you to have a body. So it's just, I think, really well put and relevant to this slide. And we just cannot talk about body image without recognizing that it's really dense work. There's a lot of, as Crystal said, there's a lot of things that influence it. It's infinite. There's a lot of factors that contribute to our body image. So there's a lot of factors that influence it. And we also recognize that this 3-part series is not adequate enough to meet all the needs of body image healing, but it might be a starting point to understanding some basics about our body image, exploring potential problems and obstacles, as well as introducing some tools that might help us to begin working towards a healthier body image or continue work on a healthier body image.
Emily, I really love you saying that, like, we may not love our bodies 100% of the time. I think that just, like, gives me personally so much relief that I have permission to, like, have a day where I'm not feeling it, you know? And that's okay and that's normal. And in the long run, that may actually help me accept living in my body more if I give myself permission to have days where, like, I'm not really enjoying being in
Yes.
the body.
And I think this is a great point to add something that I hear from clients, and I feel like I've struggled with in the past too, is we hear a lot about body positivity and feel like if we don't feel great about our body all the time, we actually feel bad for not feeling good about it. So it's really like this expectation that's really unrealistic and adds to more distress versus easing some of it. So yes, I think it's just so important to acknowledge, like, it's okay. We don't have to love our body 100% of the time. We just don't want to hate ourselves through it. And being able to work towards acceptance, even if you don't love your body, for some people is a good first step.
Yes.
All right, so I'm going to talk a little bit about, like, the relevance and how body image really is important in our lives. And as we mentioned, there's lots of influences for our body image, but our body image can influence lots of things as well, such as our eating patterns, our mood, our overall well-being. And there are different studies, but we identified one study here that applies more specifically for college-age students. And this particular study found that almost half of college students who participated in the study experienced some degree of body image discontent or difficulties. And of those participants, half of them reported their body image contributed to significant distress or impairment in their daily lives. And that's, again, something that we'll talk a little bit more about, like what that significant distress might look like. So it's definitely relevant, I think, for everybody, particularly for like a traditional age college student. It's a time of great transition. And the bottom line here in terms of relevance, I think, is that chronic unhealthy body image can leave us really vulnerable to developing other unhealthy coping habits. And so that's a reason to really pay attention to body image and recognize if it's something that is an issue for us so that we can strive towards improvements. And since I mentioned how body image could impact eating habits, it's kind of goes without saying that I wanted to touch a little bit on some statistics about eating disorders. So 30 million people in the US will struggle with what would be considered a clinically significant eating disorder at some point in their life. And what we know is that prevention and early intervention efforts aimed at increasing our body acceptance can really reduce disordered eating symptoms. So again, having a healthy or neutral body image might protect us somewhat from developing some of these disordered coping mechanisms. Also, chronic dieting can lead to health problems, eating disturbances, and other emotional distress.
So it's important for us to note here that having body image issues does not necessarily mean that you have some type of eating disorder, body dysmorphia, or another clinically diagnosable disorder. In fact, body image issues are so common. These feelings of dissatisfaction or distress can impact all of us at any given time. So we've made a comparison to help distinguish some of the differences between experiencing what we would consider to be maybe more typical body image dissatisfaction, which still may be significant and cause distress. But we want to differentiate it from some of the actual criteria for some disorders in the DSM-5. So I'll just kind of run through some of these. Weight concerns may be a primary complaint when you're experiencing body dissatisfaction. You may feel unhappy with your size, shape, or a specific physical attribute. Experiencing some kind of body image dissatisfaction may increase anxiety, shame, or just feelings of self-consciousness. It may also sort of prevent you or cause some kind of barrier to engaging in social activities, which can then lower self-esteem, and it can contribute to a negative or distorted body image. Again, these components are all sort of criteria that we consider to be more typical of body image dissatisfaction, having what we would call maybe a negative or less healthy body image overall. For some of these clinically diagnosable disorders that we mentioned, such as eating disorders, body dysmorphia, etc., these criteria include an intense fear of gaining weight. This fear can often be debilitating, and the fear can contribute to much of a person's decision making, including restricting behaviors like not eating as much as maybe they ought or need to nutritionally, or over-exercising. Another criteria would be an overemphasis or preoccupation with perceived defects or flaws that are not observable or appear maybe slight to other people. I hate to use this word, but almost what we would consider to be sort of an obsession with certain flaws or defects that we see but others may not see in the same manner. This can cause significant emotional distress or impairment in day-to-day functioning, and a negative or distorted body image coupled with that, again, sort of obsessive thinking about these perceived defects is another criteria of some of these disorders that are diagnosable. So I do want to say that relating to one bullet point on the right-hand side of the screen underneath the diagnosable disorder criteria does not necessarily mean that you have a disorder. But if you do find that you experience more of the criteria listed on the right under disorder, we would encourage you to consider seeking some professional support for more information. Next slide, please.
Perfect. So when Crystal and I were designing this presentation, we spent some time talking about being able to have a visual for kind of teasing apart that the differences between the previous slide that she just spoke about. So we talked about using a different scale versus like a scale of weighing yourself to assess how much your body image is impacting your daily life. So this is really kind of more of like a pain scale, but it is a great scale to apply to thinking about how much distress does your body image cause you in your daily life. And so when you look at this scale, if you find yourself being on the, very distressing, intense to unimaginable, unspeakable distress, then that would definitely be probably a good indicator that you might need additional help or support, or at least some work on body image improvement. And it really, I think, just kind of likens it to a spectrum, right? So we can identify with certain areas of discomfort, but we just kind of ultimately can be able to identify is this something that's really a problem for me, by thinking about how much it impacts us in our daily lives. Mm-hmm. So we liked this visual and as how it relates to how much distress our body image is causing us.
I do love this visual. I think so many times we can get sort of caught up with that number on the scale, or even certain measurements that we may take of our bodies, monitoring size and shape. And that alone can be such a distressing experience, but we usually don't stop to think like, how distressing is it for me right now to be looking at this number on the scale? Or how distressing is it for me to be constantly thinking about my size and shape changing? And really that distress is what we do have some control over. We have some like authority over, and we need to give ourselves that care to try to lessen this pain as much as possible. I like this. I think that no pain, that is so ideal. But again, thinking of it as that continuum, I think is just so realistic, knowing that you can go from no pain to sort of intense just in a moment, but then kind of scale back down, I think is really helpful.
Right. And really thinking about how much time you're spending on which point of the scale too. So like you might be at a 7, 8, 9, 10, but that's not where you are most often. Most often, maybe you're on the lower end of the scale. But if you're frequently on the other end, that can give you some insight into how distressing your body image might be influencing you. And, you know, I was even thinking about too, when I look at this scale, thinking about clients that I've worked with, thinking about myself, even like it's also not a parallel to our weight, the number on that scale. So I've definitely worked with clients that, you know, have a higher weight, but are experiencing less discomfort or distress from their body image. So they are not parallel to each other and not necessarily, you know, congruent in that way. So just because your weight changes doesn't mean that you won't necessarily have improvements or more distress on the on what we're considering like the body image tolerance scale.
And that's a great point too, and something that we'll discuss in another part of our body image series. We are going to be talking about sort of that focus on weight. We'll bring it up today, but we'll be talking even about some phobia with regards to weight and larger bodies, and even get into some fat phobic thoughts, how that influences our culture, how it influences students, but also clinicians as we're working with people.
Great point.
So, why does body image matter? Your body is your home, and it is one of the only things that's going to be with you your whole life. So, and it's guaranteed.
True.
So, this is something that not only impacts us, but living in our bodies, this experience of embodiment, it is a lifelong process. So body image can, as we've discussed, it can cause distress or impairment in our day-to-day lives. It can impact our self-esteem and even impact our relationships with others, can increase our preoccupation with our physical appearance. And when we talk about that, we will talk about this more in the series. This increased preoccupation with our physical appearance can often sort of color the way that we see the rest of who we are. So our personality traits, our strengths that we have, even our physical strengths. Sometimes our physical appearance can cloud our judgment of ourselves as human beings in a more holistic way. Body image can contribute to gender identity development. So this, and we'll talk about this, but body image can be a really great issue for individuals who are transgender or individuals who identify as being LGBTQ plus, because there is such an idea that our body needs to match how we feel about ourselves and how we see ourselves, including our gender identity. And when those two facets of who we are do not match, we often feel a lot of distress. Body image can increase our social anxiety. It can affect our sexual fulfillment. This can be a really big barrier when we are in relationships with other people. And if we're not feeling comfortable with our body, it can often prevent us from engaging in more intimate relationships, or it can provide some kind of barrier where we're hyper focused on our bodies and the way we feel about our bodies, and we're not able to really enjoy sex and intimacy with others. It creates a distraction. Body image can bring about eating disturbances, as Emily mentioned, and it can intertwine with other mental health issues. Next slide, please. So it is important to note that the cultures and subcultures which we're a part of impact our body image heavily. There may be certain attractiveness values in different cultural groups, and this is okay, but it is important to think about as we consider how our own personal body image has developed and what has impacted us lifelong. So colorism is one such cultural experience that certain people experience, including myself. I did sort of speak to a light skin privilege that I experience, and in many cultures, the color of one's skin is a determinant of perceived values of attractiveness, even human value. And so the lighter the skin may indicate, the better the person. This is not an actual reality, but it is something that impacts many people's lives in the sense that people do have to live with this sort of colorism. As I mentioned, LGBTQ plus individuals may be at higher risk for body image issues, and some of this is because of the differences that individuals may experience in their actual physical body and their gender identity, and really trying to get those two things to match for them. Trans individuals are at an even higher risk for eating disorders because of this. There is an increased desire for congruence between their physical body and gender identity, and this can contribute to the risk for eating disorders. Family experiences and relationships are huge factors in our body image development. Any one of us can think about growing up in our family system and how individuals in our families may have talked about their own bodies, talked about eating behaviors, what is attractive, what makes you valuable as far as your body shape and size. And some of us, unfortunately, have experienced some negative experiences in our families regarding the way we look or feel about our bodies, as well as some bullying that may have occurred growing up or even currently. These things really yes, go ahead.
I wanted to add something here, and maybe you're going to touch on this, but not just how our family might talk to us growing up, but even the habits that our family members or the household that we grow up in, that caretakers have or other siblings have, that we might emulate or see as healthy behaviors when maybe they're unhealthy behaviors.
Mm-hmm. Yes, it's sort of like this transgenerational transmission that's very it's not overt, it's not being communicated, but you watch maybe a parent or a grandparent sort of judging their own body. You can maybe see their facial expressions when they look in the mirror and perceive that they're not happy in their body, can see them judging maybe their size and shape or their eating behaviors, and that can sort of transmit sort of implicitly. And that's a great point, Emily. And these things occur too in our social settings. So in our home lives, this is something that impacts us, but also in our social circles as we grow up in different school systems, depending on if we see other people that look like us, that are shaped like us, have the same skin color, hair texture, etc., we can experience these implicit sort of biases and values, and they can really impact us, even if we don't necessarily experience bullying or overt negative criticism about the way that we look. Our body image is also impacted by some genetic components and inherited physical traits. I know, in my family, we all have a similar facial feature that's very common to a lot of Middle Eastern people from Iran, which is where I'm from, and it is the nose. And this is something that we inherited. It is a trait that goes with us. It goes with the children, that my sisters and myself have had. So um, these things are important to consider, that we may inherit some kind of physical trait and that may impact the way our body image is developed, and also puberty. So we experience a lot of changes in puberty, and this can be a really distressing time for people. Typically for individuals who experience puberty earlier or later than most of their peers, and they can experience also more criticism, potentially bullying at this time, and this can be really distressing, and then can obviously impact the way they feel and see themselves later on in life as well. Personality traits, we've noted perfectionism as one trait that can impact our body image development. And what we mean by that is sort of reflecting back on that idea of obsessing over certain traits that we mentioned before when we talked about body image distress. If you have a tendency to have more perfectionist type behaviors and thoughts, those behaviors and thoughts can translate to viewing yourself and sort of wanting this perfect experience, and wanting to see yourself as a perfect sort of image. This can be difficult if this is something that you may struggle with. And on the flip side, we want to note that there is this idea that some people do have a resilience or strength, and this can be an asset. It can be a protective factor when talking about body image development. Next slide, please.
So we've done a little bit about talking about what body image is and the development there, and wanted to touch on a little bit about developing a healthy body image and what that actually could mean. So a neutral body image could be just a more clear, true perception of one's shape and viewing various parts of our body as they really are. And kind of there's a difference between neutral and positive, right? So then a positive body image might be also a clear, true perception of shape and seeing those various body parts as they really are, but also involves feeling very comfortable and confident about body and accepting your natural shape and size, and recognizing that our physical appearance actually says very little about our own character or value as a person. Now, on the flip side, we have negative body image, which could involve, a distorted perception of the experience that someone has in their body. So I think just really kind of being able to identify neutral, positive, and negative is a helpful kind of thing to identify when it comes to talking about developing a healthy body image. Also, some of the reasons that having a healthy body image would be a good thing to strive towards is because it can improve our evaluations of our self-worth. It could assist with feelings of being more comfortable and confident in our body, can contribute to enjoyment of closer relationships. And, Crystal talked about how a negative body image might impact close relationships a little bit earlier. And of course, could reduce the risk of developing an eating disorder and enhance self-acceptance, even if we might want to change something about our body or change something about our appearance. It involves having an acceptance, even if those changes are desired.
Mm-hmm. So it is really easy to get discouraged, as we talked about, when you're focusing on the number on a scale or certain physical attributes that you're really wanting to see some change in. If the numbers aren't changing in the direction that you want them to, this can be really distressing. So we want to point out that exercise has benefits that are independent from weight loss or any impact exercise might have on your body shape and size. And it's really important to focus on the impact that exercise and fitness has on your body, as well as enjoying that experience and the growth that you may have in strength and in your energy levels and things like that. We want you to try to keep exercise and fitness separate as much as possible from any complaints or concerns you may have about your body image, including weight, shape, and size, to ensure maximum enjoyment of exercise and also less self-criticism. It's possible to improve your body image while also working towards personal weight or fitness goals. So while we want you to consider that these two things can be separate, it's also okay to want to lose weight or want to change your body shape and size and work out as one component in doing so. So I know it sounds really like complicated, but the important thing to consider is that these are two separate sort of practices, improving your body image while also improving your fitness. If they can work hand in hand, great. But weight focus is so pervasive in our culture that oftentimes it can get in the way of a person's either desire or enjoyment of exercise and fitness. And we know that exercise is such a positive experience overall for human beings, and the benefits go far beyond weight loss or changes in our body shape and size. So those
Oh,
benefits,
this
yeah,
is
it
something
can
that
mental
that I
health benefits.
see so much with the clients that I work with is being able to identify that a lot of times we think of exercise as just a means of managing weight, but there's so many other health benefits, including, like we said, the mental health benefits. It releases endorphins that literally make us feel better. So it's such a good thing for stress and anxiety relief, which I think everybody could use. And so being able to even just identify that, oh, exercise is something that is good for my overall health versus just a means of um, um, having my body look a certain way, helps us to even have a more positive relationship with exercise, and be motivated to engage in exercise in a way that isn't motivated from a negative place, but motivated from a positive place of just wanting to do something for our overall health and feel good. And then also to find activities that we actually enjoy. And it doesn't have to be like a structured plan. It can be something as simple as walking. So I think a lot of clients that I work with also kind of struggle with feeling like exercise has to look a certain way too, when really it's just about moving your body for overall health.
I love that. And I love you talking about our relationship with exercise, just like our relationship with our bodies. I think that's a really like just beautiful way of putting that. I know for myself, there have been times in my life when exercise was a means to body change. And I can say that when I didn't experience the changes that I desired, I would stop exercising because I felt so discouraged. And so not only did I feel discouraged about my body and distressed by my body image, but then also my relationship with exercise was tainted because
Right.
my goal was, I wanted my body to change. I wanted it to look different because I was exercising and it wasn't changing in the way that I wanted to. And then I missed out on enjoying exercise for the sake of exercising.
And I would interject an example here as well, and something that I hear from clients, but my own personal experience with, I actually enjoy running. Some people hate it. And there was a time in my life that I
Crazy talk. Yeah.
hated it. But there's also an interesting thing of I've heard from clients like exercising with their peers for some people can be really encouraging, and kind of a certain level of accountability. But I've also heard from some clients that exercising with friends or loved ones actually becomes competitive and can become a negative thing for them. But even for myself, that like when running by myself, I was competitive with myself and I wanted to like be faster and beat my next time, and just was really focused on being faster. And that actually took a lot of enjoyment of running away from me versus like just really listening to my body and be like, just run, just running is good enough. It doesn't have to be a certain speed.
Extreme, yeah.
I actually had a hard time with being like, oh, walking is also okay, and walk running was okay. So I got to a point where I started to accept that, like, run to the pace that feels good and comfortable for you.
Mm-hmm.
I enjoy running so much more, and I don't feel as like, I really started to feel physically bad after running because I was pushing myself way too hard instead of just like run at the pace that feels comfortable. And now I don't, like, when I think about running, I'm not like, ugh, where I definitely have experience in the past is like, it's actually enjoyable because I don't have to push myself. I just go at the pace that feels comfortable.
Mm-hmm. Listening to your body is so key in all of this, and everything that we're talking about. That's really what stands out to me, is that the more we ignore our signs of distress and our warning signals, whether it comes to eating behaviors, exercise, or the way that we're viewing ourselves, then the more trouble we can get ourselves in. That's a great point. So, and the desire to lose weight or have these changes does not mean you have to have a poor body image or an unhealthy or negative body image. You can still enjoy your body while also wanting to make changes. One thing that we talk about in therapy and counseling is this idea of radical acceptance, which means exactly what it says, which is radically accepting things as they are. It is a very radical practice, even if they seem to be sort of oppositional. So one of the phrases that I like to use when practicing radical acceptance with clients is, you can have both. And that's something that we need to give ourselves permission to do. So I like to use that with regards to emotions. You can have both joy and sadness. The same thing goes for our body image. You can have a healthy body image and want to lose weight or want to change an aspect of your body. You can enjoy living in your body and want to make these changes. Next slide, please. With that being said, this idea of radical acceptance, you can enjoy your body and also want to make changes. This applies to any considerations about cosmetic, plastic surgery, or any type of surgical enhancements. It's okay to want to make these changes. We are not anti-surgery or anti-cosmetic procedures here, but we do want to point out that surgery, while it can be a catalyst for body acceptance or improved body image, it's not a magic wand. It may improve the quality of life for individuals who have had some type of traumatic or congenital disfigurements, which is, again, this is something that's really wonderful. And it can improve that quality of life, especially if someone's motivation is to have just a better life experience. But if that motivation is rooted more in a negative body image and not really being able to accept just their embodiment experience, then sometimes even after having some type of surgery or enhancement, that negative or unhealthy body image can persist even afterwards. So that's really important. We want people to recognize that if you decide to make a choice to have some type of cosmetic surgery, plastic surgery, or any type of enhancement, please know that, again, your body image is sort of a separate process, and accepting yourself is still, you are worthy of going through that process of accepting yourself, regardless of whether you decide to make these changes. Next slide, please.
So we couldn't talk about body image without talking about the current impact of COVID-19. So at the time of this recording, it's July 2020. So we are in the midst of this pandemic. And I see Crystal smiling because when we look at this image, I can just hear her saying how cute she thinks Barbie looks both before and after in this image.
Definitely.
But something that I know that I've seen a lot of, and I know you've seen it too, Crystal, especially on social media, is a lot of the, comical images about what's happening with weight and body during quarantine and how our changes in habits because of quarantine might be impacting our weight. And while some of it, is humorous, it really can have a big impact for someone that's struggling with body image. And what I think is so important to focus on, and this applies to any time, even outside of a pandemic, is that the last thing that we need is additional stress. And so if someone gains 10 pounds during a pandemic, honestly, that's the least of my concerns. I'm more about like, are you able to get food? Are you able to take care of yourself and your self-care versus like what physically or looking like? Because honestly, just coming out the other side of this is the most important thing. But
being intact.
Yes, can be. There's a lot of layers to how this pandemic is impacting people. So a disruption of our typical routines. There might be changes to our cooking habits, our exercise habits. So that might result in a change in our appearance. And that's not necessarily something that we need to be distressed about. Easier said than done.
Mm-hmm.
But, certainly a term that we've heard has been the quarantine 15. And, like we said, like I mentioned, the other, humorous, comical things that we've seen about changes in weight during this time. And, definitely feeling like maybe there's an increased pressure to diet and exercise to avoid weight gain during this time. And like I said, we just want to come out of this on the other end best we can, and try to minimize any additional pressure or stress.
Mm-hmm.
Due to the nature of, isolation or quarantines or whatever, different work or school situations look like, we might also have extra time for media consumption. And for someone that's struggling with body image, this might not necessarily be a good thing depending on what we're viewing. And also might have just an increased opportunity to be looking at ourselves, especially virtual meetings and classes. And so for someone that's feeling distressed about their appearance, having these increased opportunities of viewing themselves in a way that maybe they weren't before can be really triggering. And so really all this is just to say, like, again, it's understandable if someone is struggling with body image that this would kind of add another layer of challenge to it, but also just another reason to be more aware of some of these habits that we might be engaging in that are different than what our norm is.
Yes. And, I want to point out too, this is something that you and I have talked about before, but when we talk about coping skills in counseling, we talk about a variety of different things. And it's important to know that cooking and eating, preparing food, those are all coping skills. Certainly they can become less helpful coping skills at times in our lives, but the reality is they're actually like pretty healthy coping skills overall. So like, shopping for items to prepare or gathering items to prepare a meal, going through the process of preparing and cooking or baking, and then consuming the meal, especially if you live in a home where you can consume it with a roommate or a family member. These are great coping skills that help us to enjoy food, enjoy other people, enjoy the experience of cooking, and just like enjoy living. So one, like, know that if you're using that or any of those things as coping skills, it's okay. I think we often want to kind of beat ourselves up for eating to cope. I think what we need to just consider is that with this pandemic, we have so much more stress, like you were saying, Emily. So again, it makes sense that we would use more of the coping skills that we have at our disposal, like cooking and eating. I mean, everyone's, baking bread and cookies, and people have, tried out all kinds of different routines during this whole pandemic. So it's normal. If you need support with it, certainly we have professionals like Emily who can help kind of support you in some of your nutritional choices. But otherwise, I think it's really important to just kind of normalize this experience of using a coping skill maybe more than usual, and then, hopefully there will be a time where you won't have to do that.
It relates so much to the pain scale that we were talking about earlier too. Like it's still a spectrum. We often tend to think about habits or behavior as being very black and white. It's good or bad.
Yes.
We tend to label food as good or bad, and that's something I think we'll touch more in another part. But really, just trying to recognize that even if you are finding yourself engaging in a habit that you're not used to, it's not necessarily inherently this like bad thing. It's really, again, about our relationship with food and how often does it fall on what end of the spectrum.
Yes. Yes. Great points. So we really hope that you choose to join us for parts 2 and 3 of this 3-part series. For next time, we do ask if you would like to join us, or even if you wouldn't, you can consider some of these questions that we have for you. So we want you to start thinking about some of your strengths and vulnerabilities when it comes to your body image. And there's no right or wrong answers to this. So try to be as honest with yourself as possible as you practice this self-reflection. You may even want to journal, write, or type your responses so that you can bring them to the next part of this series or bring them to a professional who you may be seeing. So our first question to you is, what are your complaints? Are there specific parts of your body shape and size, your weight, your eating behaviors? Are there specific behaviors that really bother you? And what situations cause distress for you? This may be social situations, maybe looking in the mirror, maybe being intimate or having sex with a partner. How much are you invested in your physical appearance? So I like to think of this also sort of like a scale or even like a pie chart. When you think about yourself as a human being, how important is your physical appearance to you? And you can compare that maybe with other attributes like your physical strength, your resilience, your character development, and sort of plot them out on a pie chart and see, does your physical appearance take up about half of the chart? Does it take up more? Take a look at that. How do you cope with being dissatisfied or in distress? We talked about eating to cope. We've talked about exercise. So how do you cope? Are there healthy ways that you do cope? Are there some unhealthy ways that you might cope, or less beneficial ways of coping that you might utilize? And how does your body image influence your life as a whole? So as you respond to these questions, please, again, know that your responses may cause you a little bit of distress, and it's natural. Many people do experience distress when thinking about their bodies and their own body image. If you feel you do need additional support, please reach out to us at the Student Health Center or utilize one of the resources we have for you on the next 2 slides that you think might be helpful to you. Next slide, please. So the first,
oh, sorry, my bad.
that's okay.
Hey, it's you.
The first resource listed on the slide is MindWise Innovations. This is a self-screening tool that we have on the Student Health Center website, and you can complete these assessments anonymously. You have the option to complete a generic sort of assessment and answer general questions about your health and well-being, or you can select specific assessments to target any specific issues you might be facing and answer questions that pertain to those issues. So MindWise will assess your answers, and again, it is anonymous, so please be honest if you decide to use this, because it will offer suggestions to you based on your responses and give you maybe some next best steps in improving your overall health and wellness. The Renfrew Center is listed below that. This was the first residential eating disorder facility in the U.S., and they've been treating eating disorders in adolescent girls and women since 1985. Aside from some treatment options that are available at their center and virtually right now, Renfrew has excellent online resources and educational materials, including interactive online quizzes like, do you have a healthy relationship with food, and do I respect my body, which you can take at your leisure. Next slide, please.
Awesome. This part's me. So we have some additional resources here. And one of the resources, of course, that we've mentioned a few times is additional parts to this series. So parts 2 and 3. The Student Health Center, of course, you can visit the website to see the different providers and how to schedule an appointment. And what types of appointments are being offered in different programs and resources. We included a picture of a body image workbook that Crystal and I have both looked through and find to be a really helpful resource. And so just wanted to include that visual there so you could see what that book looked like. Marcy Evans is a registered dietitian that I quoted her earlier. She has a great website with wonderful information, including information about body image. The National Eating Disorder Association website also has a ton of information, but also lots of just kind of information about eating disorders, but there is some additional information about body image as well. And then a couple of other websites listed here for Body Positive and Dove Self-Esteem Project, just if you're looking to explore some additional things there.
So thank you all so much for listening and even participating with us today. If you have any questions, please feel free to email Emily and myself directly. And if you want to schedule an appointment with us or follow us on social media, you can see our handle at the bottom of the screen. We welcome you to do so.
Definitely would love to get feedback as well about the presentation and any thoughts that you think might improve it as well. So feel free to email us as well.
Yes, and join us for parts 2 and 3.
Please do. I think that's it. Thanks for joining us. Bye.